Amputations, untreated hepatitis C, delayed cancer diagnoses. These are some of the conditions that incarcerated people face in state prisons, as documented by Mississippi Today's Behind Bars, Beyond Care investigation. Following our investigative series, Representative Becky Curry, the Republican chairwoman of the House Corrections Committee, says she's going to try once again to pass prison healthcare reform legislation after a similar effort failed to pass last year. The findings have come to light as the state continues to direct hundreds of millions of dollars a year to a private medical contractor, Vital Core Health Strategies. Representative Curry says she'll introduce legislation this year based on findings gleaned from numerous tours of state prisons, as well as Mississippi Today's reporting. In our investigation, Mississippi Today has documented the alleged routine denial of health care in state prisons, revealing how potentially thousands of people with hepatitis C went without treatment, how one person with an untreated broken arm required amputation, and how delayed cancer screenings left one woman with a terminal diagnosis. An ex-corrections department official told Mississippi Today that people in Mississippi's prisons are experiencing widespread medical neglect and turned over internal messages between corrections department officials complaining about the quality of care provided by Vital Core. During the 2025 legislative session, Representative Curry presented a wide-ranging list of examples that she said showed the inadequate provision of health care in state prisons. And according to her, some of those instances of alleged medical neglect resulted in the unnecessary suffering and death of incarcerated people. Representative Curry said many of the issues persist because the Mississippi Department of Corrections is policing its own delivery of health care in prisons. Last year, Representative Curry introduced numerous prison health care reforms, including giving authority to the Mississippi Department of Health to review prison health care and make policy changes, making sure that incarcerated people have access to 24/7 medical care, dispensing medication in a way that ensures people who need it actually receive it, and waiving fees for a wide range of medical services. The previous bill, which passed in the House and Senate, died in late negotiations between the two chambers and allegedly drew opposition from the office of Governor Tate Reeves. This year, Representative Curry has introduced a bill to create a neutral official within the Corrections Department who would investigate complaints related to prison health care. Curry also wants to overhaul the process by which incarcerated people request medical attention. People in prison often still need to rely on guards to bring them to the prison infirmary. This arrangement gives guards who are not medical professionals the power to determine when an incarcerated person receives care. In October, Mississippi Today reported on the case of Christopher Booz, a 38-year-old Mississippi man who fell off his bunk at the Central Mississippi Correctional Facility and broke his arm. Booz was allegedly denied treatment by guards for a week and developed sepsis. He was serving a 1-year sentence for a drug court infraction when he had his arm amputated. Booz filed a federal lawsuit seeking $5 million in damages. To prevent similar incidents from happening in the future, Representative Curry wants new requirements for ensuring inmates receive immediate care when requested. Curry, a former nurse, says, quote, "The problem is we keep zero records and there's no accountability." Documents and private conversations reported by Mississippi Today show the spread of hepatitis C also appears to be widespread across state prisons. Effective hepatitis C medications can cost Mississippi almost $30,000 for a 6-week course. Many state prison systems have negotiated lower prices for the medication and are able to treat more patients, but all of the savings are not being utilized, including federal programs that can offer up to a 50% discount on drugs. As of October 2025, MDOC had not yet taken steps to access the discount, a health department spokesperson told Mississippi Today. Senate Corrections Chairman Juan Barnett said that he wasn't completely satisfied with the performance of Vital Core, the private medical contractor that has raked in hundreds of millions of dollars to provide health care in prisons. Barnett also said he wants to center efforts in his committee around reducing Mississippi's prison population. When you get the population down, then you have more money at your disposal to handle medical issues, he said. Mississippi has one of the highest incarceration rates in the world, 661 people per 100,000. About 19,500 people are currently incarcerated in state prisons. In a state with such a high incarceration rate, Representative Curry has traveled to prisons to speak with people about the issues they face when seeking medical care. Despite damning evidence that people in Mississippi's prisons are receiving inadequate medical care, Representative Curry says she has waged a lonely push for reforms. Mississippi Today is continuing its investigation into the alleged denial of health care in state prisons, and you can read more of our coverage at mississippi today.org.